afternoon, everybody. Thanks so much for coming to the session. We're talking about digital interventions at the intersection of climate and health. I've got a great panel today, but we thought we'd just start off by doing a little bit of a pulse in the crowd. Who here is from the global health space? Okay, and who is from climate? Yay, we've got a mixture. That's really good. Who's an implementer? Implementers? Funders? Anyone from policy? Yes, okay, fantastic. So we've got quite a diverse group, which is fantastic because I think we really need to think about working in a transdisciplinary manner to solve some of these problems. So I'm really glad that we've got such a diverse group of people. So I'm just going to kick off and introduce our panelists and just get them to tell us a little bit about themselves, and then we'll move on to some questions. So Adetunji Aleso is the Director of Scale and Sustainability at Grand Challenges Canada. If you could just tell us a little bit about yourself.
Sure. Thanks for having me. Been at Grand Challenges now 5.5 years. Really looking at how do we enable innovations go to scale with our funding, with our ability to work in specific ecosystems to create that demand pool for innovations. And we're really excited. We've got lots of history, funded 1,700 innovations. And so we're looking at taking all that knowledge, all that experience, and enabling more things to go to scale because the quantum of the problem is really big, and the goal is to reduce that.
Absolutely, thank you so much. And then Simone Sinclair, who is from the Health Promotions Department at the World Health Organization. Tell us a little bit about you and how the World Health Organization is thinking about this challenge.
Yeah, thanks so much, Debbie. Simone here. Good afternoon, everyone. I work with the Department of Health Promotion, and so I focus on the prevention and management of NCDs. My specific area of focus is tobacco control, and I currently lead an initiative that looks at transitioning farmers from tobacco to alternative crops that are nutrient dense and climate resilient. We're currently active in Kenya and in Zambia. And I also support WHO on digital innovations around the prevention and management of NCDs, which is where we align today. Thanks.
Thanks, Simone. And then we've got Felipe Colom, who's the technology lead for Data for Science and Health at the Wellcome Trust. If you could tell us a little bit about yourself.
Hello, everyone. Well, my role at Wellcome is to look after the portfolio on digital technologies for climate and health. Before joining Wellcome, that I joined 3 years ago, I used to be an academic. For the past 18 years, I've been working as an academic at the interface between climate and health, looking mostly at the impacts of climate on vector-transmitted diseases, mostly mosquito-transmitted diseases. And at Wellcome, we fund research that is trying to address or fill the gaps in our understanding of how climate impacts health. But we also support evidence-based science and the development of evidence-based policies. At the moment, we have one of the biggest climate and health teams in the philanthropic organizations across the world. And we are trying to be at the forefront of the development of innovative research on this space, not only on the development of the science, but also on the development of digital tools for implementing the evidence that is being researched across the academic world.
Thanks very much. And then last and certainly not least, we've got Nick Pearson, who is the founder and co-executive director of Jacaranda Health.
Hi everyone, good afternoon. My name is Nick Pearson. I'm one of the co-executive directors of Jacaranda Health. Jacaranda is an organization that believes that all mothers and newborns deserve to experience childbirth safely. We're based in Nairobi, Kenya. Most of my colleagues are based there. And we work primarily with the health system, government health systems, to improve and pull levers that reduce poor outcomes for moms and babies. And so we have several programs that address some of the gaps in quality of care and experience. We do nurse training in emergency obstetric care with mothers across the country, and we also work with our government partners at the county level, engaging them on providing data and access around how you can more equitably allocate resources to high priority maternal health things. The program that we run that's probably most relevant to this conversation is called Prompts. It's a digital health platform where we engage mothers through the pregnancy journey. It has a lot of similarity with some of the amazing work that Reach does, where it's an SMS intervention. Mothers enroll in this platform. They get messages throughout the course of their pregnancy, throughout the first year and a half of their baby's life. And it's both improving changing behavior, empowering with a voice in the health system, but also there's an AI-enabled help desk on the back end where we're having conversations with them through the course. And so we drive maybe 12,000 questions a day and work across about half of the country. So there's hundreds of thousands now, 3 million moms on the platform who we've been engaging with through their pregnancy journeys. And we can talk later about how we've started to sort of walk into that intersection between climate and health as well.
Thanks very much. So I'm going to kick it off with a little bit of background and understanding of the problem that we're facing at the moment. I'm going to ask you just to kick us off, please, Simone, and tell us a little bit about, can you share any specific examples about how climate change is impacting some of the work that you are spearheading at the WHO?
So I work in NCDs, which is shorthand for non-communicable diseases. And so for those of you who may be a little less familiar, these are chronic diseases like heart disease, cancers, chronic respiratory conditions, diabetes, and mental health disorders. And while these are largely preventable diseases, they're actually the world's biggest killers. We know that they take 41 million lives every single year, and they're responsible for 75% of global deaths. And unfortunately, they really hit vulnerable populations the most. We know that premature deaths, it's 86% that we see in low and middle income countries. And these diseases aren't just driving, health issues, but they're actually driving families into poverty because of the financial hardship that they usually experience when they're trying to pay for this long-term treatment and accessing care. So I want to talk about it from two different angles. One is on the risk factors for NCDs. We're looking at commercial industries like tobacco, alcohol, ultra-processed foods. And these industries are not only fueling the NCD crisis, but they're actually in some cases exacerbating the climate challenges. So if we look at tobacco as an example, we know that farming contributes to deforestation, to CO2 emissions, it degrades soil, it contaminates water. And smallholder farmers are essentially pushed into poverty, all for a crop that kills over 8 million people every year. And then when you layer the climate crisis on top of these NCDs, it only deepens the challenges we see. So one obvious one might be air pollution. Of course, it's exacerbating respiratory conditions like asthma and COPD, but also heart disease. When we look at extreme weather patterns like heat, it exacerbates cardiovascular issues. If we look at food systems that are disrupted, we see this a lot of times in small island developing states where agricultural systems become unviable. Families are becoming reliant on processed foods, which of course contributes to obesity, diabetes, and hypertension. And then finally, when we look at migration because of climate patterns, so moving from rural to urban settings, people are more exposed to air pollution, sedentary lifestyles, unhealthy eating habits. So when we're talking about health and climate, these aren't just parallel crises, actually they're completely interlinked.
Absolutely, and it's complex. Yes, go ahead, Philippe.
If I may, just to add about the extreme heat part of the crisis, there's an intergenerational issue here as well. I mean, a baby that was born in the 1960s on the current pledges would be exposed to about 2 to 4 heat waves throughout their lives. But a baby being born on the 2020-2030 period is going to be exposed to between 20 and 40 heat waves or extreme heat events over the course of their lifetime. So there's an intergenerational justice issue that has to be addressed as well. It's not only about the impact that it's going to pose on populations, but it's also about the inequity that is the climate crisis is posing on populations. And Simone was talking about non-communicable diseases, but there's also the communicable diseases or infectious diseases that will have some level of impact on the populations. For example, diseases like malaria or dengue or West Nile virus are going to increase not only the population at risk, but also the length of the transmission period. So there's not only more people that are going to be exposed, but they are going to be exposed for longer periods in many regions of the world. And that also has to be considered because health systems in the world may be unprepared for dealing with the new circumstances, not only because the disease was absent in those areas, but but also because the disease may have been absent in some periods of time where now it's going to be more common.
And in MNCH, Nick, how are you seeing this play out?
Yeah, I'm happy to build on the comments that Simone and Felipe made, which I think was a really great overview. Obviously, our lens is primarily maternal and infant health. And as you would expect, I mean, all the sort of general indirect factors, the disease vectors are important, you know, but at the same time, moms and babies are a particularly vulnerable population. It's both physiologically a vulnerable time, also your access and movement is somewhat limited. And so, you know, we see extreme heat results and also access to care during flooding and things like that, as well as some of the indirect incidence of increased incidence of malaria, which is something that impacts pregnant women particularly, indirect impacts around sort of food insecurity and nutrition and early child development. This was the sort of start of our journey actually about a year ago. You know, we were thinking about this problem, and we realized we had a huge amount of data from conversations that we've been having with mothers across Kenya. So, you know, hundreds of thousands of conversations, millions of mothers over the last couple of years, and they're all geolocated by over 1,000 health facilities across the country. So we knew where the moms were and what they were talking about, including one of the things that our sort of help desk does is it sort of elicits risk signs, danger signs. So when they have questions around sort of an emergent problem or some complication, they often come to us first and ask about it, and then we refer them into a health facility. So there's some interesting insights around sort of trends in challenges in pregnancy. And so what we did was we took that geolocated data across these 1,000 health facilities and overlaid it with climate and extreme heat data. As Filippo was mentioning, extreme heat obviously is a big impact for moms in, you know, everything from sort of hypertension and preeclampsia and preterm birth, things like that. And so we wanted to just see, like, dig into whether there was actually a correlation that we could see there. And, you know, as you would expect, there was. And so, you know, in instances of these squares where we saw sort of more days of extreme heat during the year, you would actually see a spike in conversations around some of these high, sort of more critical, more urgent conditions related to pregnancy and heat. So that was, again, not surprising, but I think it was an interesting data point for the global community that we wanted to share out. And we can dig into that later, but it sort of spurred a journey for us where we're working with Grand Challenges Canada, for example, and the Rockefeller Foundation to start to do some, like, so what kind of questions. In other words, like, that's great to know, but what do you do about it? And this is where we're starting to look at things like, you know, could you proactively be communicating more with moms around, you know, risks associated with heat data, and layer in climate information, personalize that information more? Could you be talking in nurse training, for example? We work with thousands of nurses across these facilities. Could you proactively integrate training around how to recognize, you know, heat-related symptoms and address those when they come in for care? You know, could you be working with the health system and look at things like changing operating hours during hot days? You know, there's a variety of different kind of tools and opportunities, and we want to, like, explore what those look like a little bit.
Yeah, so it's clear that whether it's non-communicable diseases, communicable diseases, MNCH, climate is affecting all aspects of global health. So what do you see, Adetunji, in terms of what does the next decade look like in terms of the evolution of the impact of climate on health? And what are the most pressing challenges that we need to look at right now to prevent some of those changes over the next decade?
Thank you very much. Yeah, some of the really critical things that we're going to see over the next decade is, first and foremost, the impact of climate on public health and how that is going to be a real core priority for public health. And, you know, that includes how we infusing climate into how the system is built, what kinds of measures are we going to put in place to climate-proof the system. Other interesting things we're going to see is the advancements of technology and how that can help to mitigate or adapt or, you know, help to get the system, you know, a lot more resilient to climate. We're going to see lots around the governance too, like how do public health, big governance systems prepare and really infuse the thinking and the discussion of climate into how governance is done across the world. And we're also going to see, you know, a surge in climate health crisis and migration. That clearly we're seeing already, and it's only going to get exacerbated. So what kinds of things do we need to do now? I think, you know, from our perspective as a funder, we see, and having funded, you know, thousands of innovations over the last 15 years, it's that humility to see where the patterns are across the globe, because we fund over 100 countries, and figure out ways to enable the kind of adaptation and mitigation that needs to happen across the portfolio and step out of the way. In some instances, it's not so much about the new shiny things. Mm-hmm. It's about really just working with your portfolio companies to figure out how do you climate-proof your work and your innovation. And Nick talked about kind of some of the things that they're testing in MSCH. So I think that's a really interesting way that things that need to happen right now. Mm-hmm. I think public health systems also need to really sit up and take notice, and to be very hyper-local in terms of where the challenges are and what kinds of things need to be done. So for example, we've started a program starting with a survey to understand right at the heart of where things are happening, what challenges exist. It's easy to just think you have the solution and just put out a call and ask for things, but we've decided to take a couple of steps backwards, build a coalition around, let's go out there and hear from frontline community health workers. Let's hear from people at the front lines and understand what are the specific challenges, and then how do you layer on innovations that have been proven to helping to address some of those issues. And I think those are some of the things that need to happen now, is that coalition building. Lots of people are funding lots of different interesting things. How are we taking research and how are we translating research to implementation and getting real solutions out there that can start to address some of these issues? Because there's lots of research out there. Well, how do we do that? Those are some things that need to happen right now and can't wait.
Fantastic, thank you. Maybe over to you, Felipe. What are some of the most promising digital health technologies or programs you've seen in addressing climate change and counteracting some of the effects of climate change?
I think probably one of the most common examples that we see day in and out is the development of early warning systems for trying to predict the number of health outcomes or cases that are going to happen due to either an extreme weather event or in the multi-decadal kind of lifespan, the number of cases that are going to happen due to different climate change scenarios. So developing early warning systems allow us to be more better prepared and allocate resources more effectively. And I'm talking about early warning systems not only for heat but also for climate sensitive infectious diseases. We are also looking at the development of innovative tools for modeling climate-sensitive infectious diseases. And when I talk about digital tools, I not only refer to the models themselves, but also to the data assets that feed into these models, because you need data for being able to model most of these diseases. We have recently been allocating more and more funds for the development of climate services for health. So how can we leverage climate information either from satellites, from drones, from meteorological weather stations for making more informed decisions, and also how to use that information for driving policy that is more evidence-based. And the other thing, another example is how can we leverage artificial intelligence or machine learning methods for curating and synthesizing evidence so that people that are making policies, conducting research, or making decisions on the ground are better informed on the spot and do not necessarily have to rely on systematic reviews for doing their work. Systematic reviews are great for serving a purpose, but the problem with systematic reviews is that they are very resource intense and they demand quite a lot of time. But most importantly, they get outdated very easily. By the time a systematic review is being released, it's very likely that it's already out of date. So how can we make the evidence more living and more accessible in real time to people that are making informed decisions? So we are funding at the moment some teams that are trying to address this need. And probably lastly, is developing digital tools for attributing causality to climate change on health. One of the biggest questions that we are asked day in and out is when there's an extreme weather event and the number of health outcomes starts to increase, people ask, well, is this due to climate change? The most honest answer is, well, we don't know. And if you look at the literature, and we did that exercise, we commissioned a report 2 years ago, and you do this exercise to looking at the literature of peer-reviewed papers that attribute causality of climate change on health outputs. There's only been 10 papers over the past 25 to 30 years. 10 papers, most of which attribute causality to heat-related mortality. There's only one paper being peer-reviewed that attributes climate change impacts on an infectious disease, and that is West Nile virus. It's not even dengue, it's not malaria, it's not one of the biggest killers, it's West Nile virus. We have another paper where my research team has a paper on the review for another paper on malaria, but that's still to be reviewed. It's not yet published. So the evidence about whether climate change has been the cause of health issues is still not right there. So we need better digital tools or better modeling tools to address this. And probably I forgot one more. We can leverage also at, digital tools for creating more personalized responses to climate change. How can we leverage, for example, chatbots or artificial intelligence or large language models or any other type of modeling tools or digital tools for creating more bespoke solutions for people to be able to mitigate or prevent impacts? So for example, if there's a heat wave forecasted for tomorrow, how can I leverage digital technologies for telling, I don't know, maybe pregnant women or outdoor workers, well, don't go to work tomorrow because the temperatures are going to reach this threshold, and then probably have a cash incentive for not going to work. So we can leverage technology to create this kind of bespoke solutions for individuals and allow them to be prepared, or either for responding or for mitigating the impacts of climate.
Thanks, that was very comprehensive. I think, Nick, I can see that you've got something to add there.
Yeah, no, that was such a fascinating and comprehensive overview. I'm like, wow, there's a lot to learn still. And the early warning systems are fascinating, and I think are particularly good. I mean, obviously, like AI, some of the advances in LLMs, they're particularly good at drawing patterns from complex data sets, which is exactly what you're looking at with climate data and health data. And the ability to overlay it, and our perspective on this again is going to be more granular and touches on the last thing that Felipe mentioned, which is, we started out with sort of overlaying heat data with the sort of conversational data, and you can use AI to help synthesize data better, and that's a good sort of use for it. But the idea of using AI to also help personalize, all our help desk and messaging service has gone through this evolution. Now at this point, we're 70% of the responses are going out through the LLM because it's been trained over the years. Originally we were a very clinical team, and so sort of putting all these guardrails in place, and it's like only humans are going to answer these questions, and eventually the AI kind of got good enough that we're like, well, 95% accurate, better to just get it out now. We have 12,000 questions a day, we can't get a backlog. So, but one of the things that we're working on now, we have some work that we're doing with Google and a few of the other frontier companies where it's like, how can you take what are essentially sort of gestation-specific responses that are like, hey, you're at 6 months and you ask a question, you're at 6 months pregnant and you ask a question about, whatever, a particular symptom that you've had. And then how can you personalize the response so that it's also looking back at pregnancy history, either obstetric history or previous conversations, like, hey, that mom is not only 6 months pregnant and has this issue, but also she's talked about like a preterm birth in a previous pregnancy, or, sort of a history of hypertension. And that's going to be a different kind of response. And then you can layer on top of that, potentially, and we haven't gotten there yet, but I think would be super exciting is, exactly as you said, some of the climate data. And, what's the heat situation like, where she is at this time right now, and that would be really exciting to be able to provide a response that's not only, and I think there's a very cool example in the agriculture space. There's an organization called Digital Green that's doing some really phenomenal work with AI. And so for example, they do, if you're a smallholder farmer in rural Kenya or wherever in India, you can take a picture of your crop and be like, hey, what's the problem with this? If it's like stunted or there's a disease, and it's like uses these machine learning algorithms to sort of identify the problem and report it back. Very cool stuff. But then they've also recently started saying, like incorporating climate data into that and weather data into that, so it's like your response about whether you should water that crop or whether you should fertilize it is also dependent on the forecast for the next couple of days, which is totally cool. And I think, you know, we could also incorporate into the health space as well when we're communicating with moms or around NCDs, et cetera. And I think the next generation of some of these AI tools, you know, now we're working with LLMs, the sort of first generation, second generation, whatever you want to call it. But now, I don't know if you all have heard about these sort of agentic systems, and sort of where you're actually having multiple AIs doing different things in the health system or in whatever system you happen to have. And so their AIs kind of talking to each other. And that enables a further level of kind of action and advocacy, you could say almost, where it's like you could theoretically be providing personalized responses to moms, but then also connecting to the nearest facility and like determining whether they have commodities that are able to address the problem that she's got, or, you know, if they're affected by a local or regionalized flooding, like that kind of stuff. I mean, that's the slightly futuristic, but not too futuristic view on it. So anyway, I'll pass it back to you, Debbie.
Simone, I don't know if you have anything to add specifically in the NCD space where you've seen some examples.
Yeah, definitely. I think when it comes to prevention and management of NCDs, technology is really interesting when it comes to complementing the formal healthcare system, especially when it's strained or unviable in cases of climate challenges. At WHO, we have something called the Be Healthy, Be Mobile initiative, and this was launched in partnership with ITU, the International Telecommunications Union, over 10 years ago. And it started as simple SMS solutions for making sure that people are being followed up with care if you have diabetes or COPD or asthma, giving you reminders about appointments or medications. And during the time of the pandemic, we pivoted and we ended up partnering with Reach Digital Health and other tech companies to develop chatbots and develop AI tools basically aimed at reaching the general public with timely health information in the palm of their hand. We were on WhatsApp, Viber, Facebook Messenger, and this really transformed the way that WHO was communicating with the general public. And what's important here is that it wasn't just a one-off. What we ended up doing was pivoting and making sure that we were integrating other important health topics like nutrition, tobacco cessation, that kind of thing, mental health, so that we could continue to communicate with the general public and provide them not only with information about how to prevent disease, but also making sure that they were cared for along their disease journey. We also have Sarah at WHO. I don't know if you've seen this digital human. Her name is Sarah, and she uses AI. She can chat with you. She's a digital health promoter. She listens to your health concerns, and then she can point you in the direction of credentialed WHO information and resources. So really looking at solid content that's evidence-based and getting it in the hands of people in times when, like the pandemic, formal health systems were unavailable or strained, and this is an interesting use case for technology in that case.
So lots of wonderful examples, thank you, both in some simpler technologies, things like SMS, but also the more complex with AI and LLMs and all those very exciting things that we're able to do now that 18 months ago probably wouldn't have been even in our imagination. But when we talk about technology systems, I think it is very important for us to remember that those hardest hit by the climate change effects are often those with the least access to these very fancy technologies that we love to sit and talk about here at these sorts of conferences. So maybe, Felipe, you could talk a little bit about how you make these sorts of things accessible and culturally relevant.
Well, what we're trying to do at Wellcome is to create more inclusive dialogues with people that are going to be the end users of these technologies. What we implement now by design in our funding calls for climate and health is that the teams that are going to be applying for our funds have to have meaningful relationships and meaningful collaborations with the local stakeholders on the places where they intend to serve. So, for example, if they're going to be working with decision makers on a given country in the global south, they have to have a meaningful relationship with them. And what do we mean by that? Well, they have to be incorporated and including their input from the design of the digital tools so that they are relevant to their needs and priorities. Because one of the things that we have noticed is that about from the digital tools that we have landscaped over the past 3 to 5 years, about 75% do not have a user-friendly interface that people on the ground can use. So that has happened because there's a lot of development of what we call professorware in academia that is designed for academic purposes with the intention to serve decision makers, and that's a really good intention, but they are not designed for them because they have never received the input or the feedback from these people. So by creating these dialogues between policymakers, between decision makers and academics, we are trying to break that pattern and create tools that are more relevant. So including people in the design, the development and the implementation of the tool alongside the whole pipeline of the academic research is one of the ways in which we are trying to do that. And the other one is to create or at least advocate for some secondments or fellowships of people into the decision making or the policy spaces so that they understand the mechanisms through which policy and decisions are going through, so that they can come back into academia and feed back into these spaces. One of the examples that we have about that is we have a grant with data.org, the Global Partnership for Sustainable Development Data, and JPAL South Asia, where people are being seconded into social impact organizations for them to understand how they operate, and then when they go back into their places or if they want to create their own companies, they understand how they operate and they develop more relevant digital tools.
Thanks. You've just touched on one of my big bugbears when it comes to creating the digital technologies, and that's that we forget that people actually have to love and be able to use the service. We often come towards these things from a very much an academic perspective. This is the problem that we want to solve. Completely forget about the end user and the incentives for them in using it. So that's probably like a 2-hour conversation.
If I may, I mean, just by doing that simple thing, you increase the sense of ownership on the tools, and then you increase the probabilities of scalability and adoption, because then they are being designed for people that are willing to take it on.
Absolutely. I know Jacaranda does a lot of work in terms of accessibility as well. I don't know if there's anything you'd like to add, Nick.
Yeah, maybe, and just I think this is one of the things that Reach does particularly well, where it's like you're really focused on the end users. How do you design that experience so that the moms who are interacting and the people generally who are interacting are doing it? And I think we try and do something similar. And your point about sort of adapting both kind of technological, because there's a variety of these kinds of tools, and you have to adapt it to those sort of policymakers who may not be as digitally literate and need to be able to have simple, easy dashboards. And so there's a kind of a co-creation process that's there. That's if you're working in a health system. And similarly, when you have tools that are interacting directly with mothers or end users, NCD patients, et cetera, you want to be able to design it so that it's accessible and interpretable for them. And like, just as a side kind of anecdote, I guess for us, a big piece is, Kenya has really high literacy rates, and so, we've had to adapt some of the LLMs, and Swahili is a relatively highly resourced language, i.e. there's quite a bit of data around, and so as a result, some of these tools enable you to provide pretty accurate LLM responses just off the shelf. But still, we work with a lot of these, frontier technology companies. You talk to Google, you talk to OpenAI, and they're like, yeah, our solutions are totally like, switch the language, Google Translate, you're going to get these contextually relevant responses. It's not true. And this is on us as implementers, all of us in the room, to sort of really understand the need to contextualize both language response to language, but also to sort of cultural context. And in all the countries that we operate in, a mom going through a pregnancy journey in Ghana, for example, where we also work, has a different experience. There's different cultural mores, there's different sort of experiences, and this is, I think, one of those interesting tensions where it's like these digital tools offer the opportunity for massive kind of replication and scale, but at the same time, this tension of both the fact that climate is global, but like the impacts of climate are hyper local, so it varies a lot place to place, and so do patients' journeys, it's like, and so we need to be able to find that, ease that tension by customizing, personalizing, whether it's at a linguistic level with LLMs, by contextualizing data sets. And I think there's probably a whole side conversation around how we could leverage local data sets to inform these tools better, rather than just rely on GPT 4.5 off the shelf, or whatever. But also similarly, the design of some of the tools.
So we've seen a lot of examples about how we can leverage sort of existing trusted, scaled health interventions. Adetunji, maybe you can speak a little bit, to take a little bit of a detour. What policy changes do you think we need to ensure so that people will invest in these kinds of interventions?
Thank you very much. I'm just going to pick off a lot of what has been said here in terms of policy changes. So we talk a lot about community engagement, and we talk a lot about equity. And I think one big policy change has to be how are we strengthening that and how are we making that a priority such that it enables funding to go to community-led resilience type programs, because that's what is really at the heart and touches on the individual and would bring about the kind of change we want to see. Mm-hmm. Not just in conversations like this, but real, to the ground, very prioritized. That is a clear policy change that needs to happen, because that funding then can flow to that. I think strengthening collaboration, global, regional, is also going to be a really critical policy change, because it's going to take a village, right? As long as we center on the individuals and what they face and stop the silo thinking of this is Minister of Health, this is Minister of Agriculture, this is Minister of Information, strengthening the collaboration, across this, verticals is going to be really critical if we're going to make a real dent to this. Institutions like Africa CDC, how are we taking a broader view beyond siloed ministries? I think that's a really critical thing, because then we stop the way things are currently done, which is by budget, by ministry, and really see it cross-collaboratively. And I think those, to not go too far, those two critical areas would really ramp up and bring a lot more investment into research, into implementation research, and into kind of scaling the kinds of innovations that need to happen.
Absolutely, and I think, when you're dealing with these sorts of complex problems, this breaking down of silos is absolutely critical. And I know, Felipe, you think about this quite a lot. So what strategies can we use to break down these silos in the health sector and foster collaboration so that we can better solve these complex problems?
Yeah, that's a really good question, because, again, one of the things that we see every day at Wellcome is that people, particularly in the health sector, want to do climate and health research without climate scientists. If you look at the attendees today, there were only 2 people, if I recall correctly, that came from the climate community. So we're talking about climate and health, and there's no climate representation, and that's what happens typically in most of the proposals that we receive at Wellcome. Of course, we are a health-related funder, but if we're going to be funding climate and health, we want to have a representation from the climate sector. So what we're doing at Wellcome is that by design, we are demanding that the people that are applying for funds in climate and health, for most of our grants, have leadership from the climate and the health community. So, for example, for the attribution science work, the teams had to be transdisciplinary. So they had to involve many communities, but also they had to be led by one climate scientist that specialized in that particular field. They couldn't be just any climate scientist. They had to be specialized in attribution science and a health scientist. So by forcing them to work together, we were trying to break those silos. But we don't stop there. We also try to create these transdisciplinary dialogues. So we convene lots of workshops where people get a better understanding of the policy of the climate science and the health science, so that we can speak a more common or integrated language, because it's not the same understanding that people in the climate sector have about seasonal and subseasonal forecasting or nowcasting that the people that work in the health sector. So when we talk about these kind of issues, or when we talk about confidence intervals or credible intervals, are we really speaking the same language or not? So bringing these people together into one room and engaging them into the conversations is a way in which we're trying to break these silos.
Great, and really about working between disciplines, not just borrowing from different disciplines. As you say, transdisciplinarity is incredibly important. I'm just going to ask each of our panelists to give us a quick takeaway, and also to perhaps give us a call to action. What can the people in this room do? This is, like we said, complex problems. It is going to take a village. So what can we all do when we leave here today? I'll start with you, Nick.
It's a good set of questions, and thank you, by the way, Debbie, for pulling this panel together. It's like, to your point about breaking silos, it's a good excuse to have a chance to have a sort of cross-disciplinary conversation with a variety of different organizations. I think, building off of some of the things that have been said, and I'm not going to, congeal this particularly well, but it feels to me like, the health sector, our job is not to mitigate climate change. In other words, we're not going to solve that problem, but we can do a lot to sort of help build these climate resilient health systems. And it feels to me like, the anecdote that you gave about the sort of number of heat waves that an average person experiences over their life and how much that's changed, it's only getting worse, right? It's like 5 years from now, the problem is not going to be solved. It's going to be more prevalent, more common in the communities that we work in. And so we need to get a start with something that is actionable, practical, et cetera. And I think, on the one hand, it's great that there are people who are operating at this level, thinking globally about policy. And I loved hearing the kind of 30,000 foot view of like, hey, here's how we can influence science and decision making and policy and global policy around that. I think also for those of us who are more kind of in the weeds of implementation, there are things that we can do to start just putting this stuff into practice. And so, for us, it's about, I think, real-time monitoring of health impacts. Like, how do we build ways that we can start measuring this locally and really understanding? Because it's like, and this is, again, not particularly well phrased, but like, there's all these like potential impacts. We talk about all the things that could happen to moms or, people in general as a result of climate change. But we're not sure as a community which ones of those are most likely to happen, which are going to be the biggest levers that we really need to address. Is it extreme heat? Is it vector-borne diseases? Probably all of the above. But practically within our context, it's helpful to know which are the sort of levers that we need to be working towards, and that requires constant kind of monitoring, not just sort of early warning system and disease surveillance, but also just practical, like what are we hearing from moms? What are we hearing from the health systems? That's a sort of a local thing as well too. And then secondly, in parallel to that, I think there's also this question of like, how do we just start testing some practical solutions? If it's just as simple as seeing if your local governments can open their clinics earlier, or leverage community health infrastructure in the community to do more outreach during high heat days, or whether it's about sort of mentor mothers who are able to sort of get people during before floods and evacuate them ahead of time. There's like so many different small things that we can test and sort of practically start seeing whether are these things that stick in the health system, or these things that resonate with our health system partners, the local governments that are sort of managing the health system, or these things that are going to work for them and address these problems. Sorry, that was long-winded, but
no, that was perfect. Thank you. And I think you touched on something that I think is very important, is particularly in this crisis. I think perfect is the enemy of done. We really do need to get moving and start testing some things. Felipe, how about your final thoughts and call to action?
I would say that we should not let perfect be the enemy of the good, and allow more for more equitable and inclusive dialogue, so that the development of digital tools is fit for purpose and serves the needs of the majority and not just a privileged few.
Thanks so much. Simone, over to you.
Yeah, thanks. I think in terms of what's come out of this conversation, especially around some of these digital health interventions, is we know what works, and it's now a matter of working together to scale those things, especially these tools that we know really speak to the end user and actually have an impact on behavior. But I'd also add that we can urge our policymakers to be accelerating the implementation of policies that prevent NCDs, so things like taxes on tobacco and sugary products, making sure that our youth aren't getting exposed to these unhealthy habits will really be important, especially as we have just 5 years until the SDGs, and we want to reach that target around NCDs and reducing premature mortality. But I would say in global health, we can't do anything alone, and looking for more partners always to help make these a reality. Thanks.
Thanks very much. And last and certainly not least, Adetunji.
Sure. I think as funders, that building coalitions around addressing a challenge across the entire spectrum, I think that's going to be really critical, because as individual funders, our little pots of money is not going to move the needle. And so how we, as Wellcome, as Rockefeller, as Grand Challenges Canada, as the biggest funders in climate, how are we working together to ensure that we're strengthening health systems, we're, funding really interesting innovations that can go to scale, and are really bringing all our power together to enable those kinds of things to happen. I think that's going to be critical to hopefully addressing the challenge and creating a future that we all want to see.
Fantastic. So I think it's very clear, technology plays a very important role in addressing some of these issues and creating more resilient health systems. But I'd like to open it up to the audience now and see, already a hand up, I love it. Victor, would you like to get us started?
I have my chest burning to ask this. I'm a for-profit social business. And my main question to all of you is, especially the three of you, because I would talk, is how, because I don't see a bridge between what all of you do and a social business like ours, that we are not looking for your funding, but we have data. I mean, we were given access to mental health from the US all the way down to Colombia. We have thousands of feet in the ground, and we have created trust with them, telling us about diabetes, obesity, palm oil, tobacco, heat. We saw cold when I tried to see if we were able to find a way to get in. So I'm not the only one, of course, but there's many social businesses like ours that have enough data, but we don't have a way to work with you. Or maybe I haven't found it directly. So because we don't need, of course, the funding or the size of funding that you offer. So how can we share the data, how we can be helpful for all of these causes, because I think that, as you are saying, we have to do it together. And yeah.
Yeah, I can quickly jump in on that. So we're doing a survey right now, a climate survey, global climate survey. And so the data that you have and lots of social enterprises like yours will be critical to feeding into that system, because for us, we don't want to, again, just assume we know the answers and then put out a call that says, yes, tell me how you're going to solve this. It really wanted to be data driven, and that's why we've taken our approach. So please let me talk. We need to talk immediately after this, because a lot of that data can feed into that, and we need that data, and we're looking for that data, especially in South America. So, thank you so much for asking that, and yes, we will work together and potentially fund you in the future.
So we've already got some actions coming out of this. Yes.
My name is Candela Iglesias. I'm from Mexico, and I run a small company called Jacaranda Health, where we support global health organizations to improve their training and their evidence base and evidence generation. And I think my question is a little bit, some of the first data you mentioned was a lot about mortality and, of course, morbidity, from dengue. Dengue was exploding all across Latin America. But what about quality of life, right? I think I would love to hear your thoughts of, I think some of what you addressed, about what the moms are experiencing talks to this, but what is the impact of all these climate challenges on the quality of life for people on the ground? So I'd love to just hear some examples and comments.
Felipe, do you want to take a first stab at that? Or?
I think in terms of quality of life, it's not my area of expertise, but one of the things that I do see is that the climate is going to put lots of pressure for people to adapt to the new conditions that are going to happen. So, for example, it's going to put pressure on the quality of soils. It's going to put pressure on the quality of infrastructure. So extreme weather events are going to damage infrastructure. So we have to build more resilient housing, and so the quality of life is going to be deteriorating very dramatically if we do not take proactive action.
We're talking about policies, but those policies are also about, what are the conditions that allow people to work, and when it's not acceptable to have people working, right?
Well, it's exactly. It's also about that. It's people that, for example, outdoor workers may not be able to work even. So it is about the how can we not only mitigate the climate, but also address the needs of those families that are going to be worse off because people are not going to be able to be outdoors working as they would normally do if there wasn't an extreme weather event or the temperatures weren't as high as they will be in the near future.
I think that advocacy has to come also from the health sector. I think that's where we can bring the data and the knowledge and say, hey, the working policies need to change, right?
Absolutely.
Yeah, so to my earlier comment about how health is going to become central to the whole conversation around climate, and how the quality of life and people's well-being has to be centralized. And I think that's one advocacy part that health practitioners have to make, such that way we change the conversation from just existentially we're all going to poof, or to how are we ensuring that people are more adaptable to what's coming. And it is coming, but very clearly health has to get into the center. Organizations and regional bodies that are very much health focused need to start to champion with data, with credible data. Because for governments, for example, they're not going to move until they see data. That's just how things are structured. Do we need to restructure? Do we need to reimagine? Yes, but that has to come with data. So if we're providing lots of critical data around, a lot of that baseline thing that's happening, then it forces the conversation around changing the policies that will ensure well-being and health.
Any other questions from the audience? Yes.
Myself Swapna, I am from India. Just wanted to learn that the approach that you people have developed is looking from a problem part of it. There are health issues or climate issues. Can the digital intervention be made from a solution part of it, where you create more able body to fight the climate actions? So if there is any digital intervention has happened there, anything has happened on nutrition or creating more healthy bodies or creating more healthy economic climatic conditions where the impact on health is less. So has there been any experience anywhere on any kind of a digital intervention where it has been seen from a solution perspective, not from the problem side? Because that may be the answer to why we always look it from the problem side. Why can't we really look at it from the answer side?
Nick?
It's a great point, and I think that this sort of builds on a point I wanted to make earlier, which is that I feel like there's a lot of kind of cool examples around the world of solutions that people have come up with locally that most of us aren't exposed to. So when we were kind of starting to assess, what could we actually do with this data? How could we help moms? How could we help our local health system partners? How could we help train nurses? We were looking for things out there because you're sort of building it from scratch, and there are a lot of great examples out there, but we're not, I think as a community, we're not sort of promoting them or congealing them. And so I think this sort of community, maybe this is a funder thing, maybe this is just a community of practice thing, but saw some great examples, for example, in how could you leverage the workforce of community health workers, Angamwadis, of guys in CHPs in East Africa to, help support mom. And there are a lot of digital tools that are increasingly sort of empowering them to be able to support people in these, and I use moms, but it could be anyone really in the community. I do feel like it gives you the more kind of reach just around how you can sort of task shift some of these support for end users or people who are impacted by climate to a sort of a larger workforce.
I think from our perspective as a funder, this space of climate and health is still pretty new. And so some of that thinking around finding those really interesting solutions that are very community-based, that already work, is some of the work that we need to then do, which is why from us as building a coalition of 15, 16 different organizations across the world, the Grand Challenge Network, what we're trying to do is go out there. Once we have hypotheses, then we're saying what kinds of solutions exist that are already tested, already working, let us know that. And we've built a long history of the last 15 years of 70% of the innovations we fund and we enable are very much in the local communities, which is not something you would typically find with big funders. So for us, we built that model, we understand that model really well. We want to apply that in climate and health now to find those local solutions and give them the resources and the environment to be able to get those solutions out there and provide the data that will convince governments and policymakers to change the policies.
I'm sure that's going to be much more effective than the AI. I'm from the field, I can vouch for it. It will be much more effective than the AI.
Yeah, I mean, for us, we see technology as a tool, right? Which is why for us, we're a primarily health and well-being funder, and we see the position of technology as a tool to enable. But that's what it is. It's not going to be the centerpiece and be the only thing that works. It's still going to be human interactions and human ingenuity that has to be at the heart of these solutions, and the technology helps, as Nick said, amplify, elevate, push further, and yes, so that's typically how we see the world. That's our own viewpoint of the world. Talk to and enable those who are at the ground that can solve the problems and have fantastic ideas, and then provide wraparound support around it.
Thanks very much. We do have time for one more question. Yes.
Hi everyone, my name is Grace Njunge. I'm from Kenya and I work at Dahlberg Advisors, an impact advisory firm. And my question builds off what has already been said, which is I'd like to understand, particularly from the funders' perspective, how you're balancing between channeling the quite limited funding right now to grassroots, locally led, decentralized solutions that are tailored to the problem at a local level versus trying to find ideas that already exist and have potential for massive scale. And this conversation sort of came up earlier this week at the localization conversation, and I sort of felt that tension, and I'd love to understand in this context of climate and health how funders are thinking about it. But also for Jacaranda, I'd also love to understand for you as a social sort of entrepreneur, do you think about deepening your impact in one community or think about scaling that product to lots of different communities or countries?
Maybe we can start. You've already started on this topic, so
sure.
Carry on into
Sure. Yes, that tension would always exist in terms of solutions that are already community-driven and led, and ideas that can be truly scalable. I think the way we've approached things, again, over the last 15 years is very much focused on the community-led and driven innovations and solutions. But then through our program, we're able to quickly determine, is this scalable or is it not? And where it's not scalable, understanding the perspective of the founders and what their own end game is. And in many respects, we're happy to fund those who have, are not thinking global scale or, regional scale, because we know that it's in addressing those challenges that in the future, ideas around how to scale it can then evolve. So we're happy to very much play that leading visionary role and supporting those kinds of innovations, even though we don't see the scale right now, and at the same time then see those that are pretty much scalable. But because we're very much focused on those who are at the heart of the problem, are closest to the problem, we're able to very quickly see what can scale and what cannot. And for those that don't, we're able to document the learnings and share that in a way that helps others who are going to build on top of that. So I think that's one thing that we hope to also apply with climate, like we've seen in digital, so that way we're not making the same mistakes again, and we're very much enabling those who are at the very heart of the solutions. Why we're very excited to fund people like Nick and his work, because we see how transformative that is, because it's very much at the community level.
Nick, I don't know if you want to take the second half of that question.
Yeah, I mean, it's thank you for the question, because it's a really, I feel like it's the balance that we all have to figure out. And I think, I mean, to a certain extent, obviously, like, we're an organization that's trying to scale our implementation of the work that we do. So obviously we're in a position sometimes to say, like, hey, we have a cool tool, fund it to scale. Like, that's a solution. But at the same time, I think per my previous comments about the fact that so many of these solutions end up being hyper-local, they require local organizations that know the lay of the land and understand the, I mean, we do in Kenya, but, obviously if we're in Ghana, there need to be, or in Nigeria, or in Eswatini, like, local solutions, local organizations that, like, understand the context need to be driving this, including the local governments as well as the communities. And so I think, from a funder's perspective, I would imagine that your sort of approach ends up being a mix of, like, hey, let's find some things that are potentially scalable, like a tool or whatever, but a scalable tool doesn't have to be like an organization that scales a thing. It can be an insight or a toolkit that is scalable by other people. In other words, whether that's a digital tool that's open sourced, I mean, like, the community health landscape has done a good job of creating these, like, community health toolkits. Like, hey, we're all running networks of community health promoters in different countries, but we have a sort of access, there's a great community of practice, and they have an access to a set of tools that help them, like, whether they're digital tools or whether they're policy tools or HR tools, et cetera. And similarly, I think in in our space, there could be, both policy tools like insights around like, hey, you can modify clinic hours, or you can like set up local ambulance services, and that's something that a local organization can own, versus, and digital tools too, potentially. I don't know. Maybe we can have our cake and eat it too. I don't know.
And maybe one more point on that. I think the other thing that as funders we need to be very clear about is where you've enabled and supported a solution and you see that it works. I think it's a real shame if you don't take it as far as it can go. And I think a lot of times we always stop at that. Yeah, this makes sense, it's great, it's small, it works. If we're going to be addressing those big and solving those big grand challenges, we have a responsibility where it works to take it as far as it can. And sometimes it's who's that implement at scale. It doesn't have to be the founding team. And how we're finding models and capital structures to enable that solution go as far as it can. Because if it doesn't, then it's a real shame to just leave it at that very local level when there are very many different ways that can be explored. And I'm not saying those ways already exist and plug and play, but I think it's a responsibility on the funding community to figure out how to get those things as far as it can go, because that then addresses that big issue.
And I think that's where documenting best practices and documenting lessons learned becomes really handy, because you can develop a digital solution for a very hyper-localized problem, and if you document those lessons learned, then that doesn't mean that it's going to translate exactly the same into another place, but the lessons learned and the best practices that you have used to make that operational and to make it successful can be used in other contexts for them to develop a digital solution or any other type of solution that might work.
Mm-hmm. I think that's a very good place for us to wrap up, because I think it's we can get a little bit head down, particularly as doers. But this issue is too complex and too critical for us to be relearning lessons or reinventing wheels. And so I just wanted to thank the panel for a really great, insightful and detailed conversation today. You'll see the little coasters on your chairs. We've launched a white paper about digital and climate, so please do take a look at that. And thank you to the wonderful audience for all your engagement and for listening to us for the last hour.